Going to ask, we're going to bring Dr. Mendoza up to talk to you about contact tracing and the need to make sure that your employment facility is up to date and up to speed. So before I do, let me introduce him. Dr. Mendoza is a board certified doctor in pediatric emergency medicine. He founded and is the CEO of Scribus LLC. Which is a company that provides COVID screening and contact tracing for schools, businesses, and healthcare facilities. Dr. Mendoza created a proprietary contact tracing program that has been instrumental in helping to open schools in our community. Dr. Mendoza is a graduate of Brown University and the University of Florida College of Medicine. He's a fellow of the American Academy of Pediatrics and the American College of Emergency Physicians. I'm going to turn the stage over to Dr. Mendoza and thank him for taking time out of his very busy day to join us for some important information. And then just an announcement, we'll be taking questions for all of the panelists at the end. So just put your questions in the Q&A button and we'll go for there. And without further ado, Dr. Mendoza, the stage is yours.
Thank you, Aaron. And I want to thank the Chamber for inviting me and the rest of the panelists to speak today on this really important topic. And it's my first time speaking at the Chamber, and very much welcome the opportunity. So as Aaron mentioned, my background started off in pediatric emergency medicine and pediatrics, and I'm actively practicing emergency physician here in Miami, Florida, at a local large hospital, Baptist Hospital, in the pediatric ER there. And I want to take a step back and talk about Scribus, the company, real quick. We actually started off as a medical scribe company and healthcare staffing company back in 2014. And how we kind of got into contact tracing and healthcare screening during the pandemic was that we started to, we were staffing emergency rooms, urgent cares, doctors' offices, and, our employees are pretty much considered critical need employees at the bedside and at the side of physicians and PAs and nurse practitioners, documenting for the providers for the patient experience into the electronic healthcare system. So when a pandemic hit, we started getting employees who were becoming exposed, who were having exposures to COVID or getting sick with COVID, and we had to track them and figure out how to keep our workforce active and how to keep our workforce safe, and who we had to pull off a shift and put on a shift. And we realized that if we were having this issue, there certainly must be other critical need employers and companies and schools across the country or across the county that had these same needs. So we evolved into and pivoted to this contact tracing and healthcare screening service line. We still maintain our core business, but this is a rapidly growing part of our company. So, and as a pediatric ER doctor, I still see COVID in the ER and in my patient population, so I can keep track of what's going on in the community. But this is a really important point, that we started doing contact tracing, and we call an employee exposure management program within our company to keep our company's doors open so we could keep our employees safe and actually put them in the workplace, back in the workplace when they were ready to come back. So I'll share my screen and see if I can do this. And I only have a few slides. The deck is really short, but let's see if I can do this, and do it well. Okay, so really, I'm going to talk a little bit about how to keep your business open during COVID-19. It's been really difficult. At first, everyone scurried back at home, remote working from home, when possible, happened very quickly. But like we've been talking about offline before this, was people crave social interaction, and the workplace can be more productive if you get people coming in face-to-face interactions, or at least in the office. And quite honestly, some businesses cannot be remote. So let's talk about what is contact tracing. What I'm going to focus on is really an employee exposure management program for your business. Contact tracing at the Department of Health level, or at the municipal, state level, or country level, is really figuring out who's positive for COVID, whether it's COVID or actually even flu or measles, any communicable disease, right? Any kind of outbreak. And it's been much less pronounced in years past because, certain kind of things, whether it's an E. coli breakout somewhere, or some kind of listeria breakout at some, but now COVID is obviously, it's a pandemic, so everyone's aware what contact tracing is. But the contact tracing at the government level is, or Department of Health level, is someone calling you to figure out, if you're positive, if you've been positive, who you've been in contact with, and tracking your symptoms, and that's pretty much it ends there. What we're really talking about is an employee exposure management program, which is contact tracing localized to your company. We want to find out who's been exposed, who's positive, who's at risk for being positive, and how that's going to affect your workplace. So really, an employee exposure management program combines technology we use, or anybody can use, kind of whether it's a phone-based app or computer-based app to report in to either by the employee or by the student. We do a lot of schools, or by the employer to say, hey, someone called in sick today and they work with us, and to figure out who's been exposed. We have medical direction. Need someone to really kind of figure out how to implement these CDC guidelines and how to implement the local county and state guidelines, how it applies to your business, and really keeping track of the employer risk status. Okay, so, and above all, this employee exposure management program, or any employee exposure management program, has to keep your data with HIPAA compliant, confidential. So only the few people that need to know what's going on with the company do know. And I think Aaron will talk about that a little later on in the program. So what does it mean for your business? I mean, whether you're a critical need business or not, if you have, we know most exposures, what's been happening over the past few months is most exposures have really been happening at the social, outside the workplace kind of venues, whether it's social gatherings, family gatherings, interactions in restaurants, things like that, or other places where people congregate. That's where most of the exposures are happening. They're actually not really happening in schools. We know that. We know there's a lot of mask wearing, a lot of mitigation strategies been enforced. But a contact tracer and employee exposure management program can help to identify when that exposure or someone who's been exposed or is positive comes into contact with the rest of your employees, and figure out what their symptoms are, track their symptoms, keep it all on one place with that one person that's assigned to your company, keep medical direction. You can keep certain parts of your company up and running. It also allows for your business to get back to the business of doing what you guys do. So what we saw very quickly, we're doing contact tracing for hospitals locally, for schools locally, is that people were getting pulled from all directions who don't normally do this job to figure out and do phone calls. And you can't just do something on an iPhone. We do that. We have mobile apps to report in, but that doesn't tell you that contact tracer or that person who's figuring out what's happening to an employee doesn't get needs to get on the phone with the employee and say, were you in a carpool situation? Were you in the break room? Who'd you eat lunch with? And really only as it pertains to your company, in an effort to make sure that you mitigate any outbreaks or any more exposures. If you're pulling in directors, VPs, front lines, secretaries who don't normally do this, it can really be out of their wheelhouse and also pulls away the resources where you normally need to do to keep your business open. So these are the kind of questions we ask. Does one of your employees, test for COVID-19? We help form, or you need someone to help form your company's return to work strategy. For some companies, it's much more, a little more rapid. There's certainly a situation where you need to figure out if you need to bring your workforce a little quicker. If someone's been vaccinated already, now there's new quarantine or reduced quarantine or no quarantine recommendation from the CDC for recently vaccinated individuals. Who's most mission critical? Those are all things that you can really help define with an employee exposure management program. There's obviously, following CDC guidelines is going to be, mandatory to make sure you have a workplace that's functional and it keeps on going. Okay, so staying home, monitoring the health, social distancing. I think we'll talk about that with a little later in the program. But remember, continuing to cover your mask, to clean surfaces in the workplace, and for sure, which is what a COVID employee exposure management program does, or contact tracing does, is containing any potential exposures or outbreak. Vaccines are a big question. So we have vaccines coming into the population now, mostly anybody 65 or over, frontline healthcare workers and frontline individuals will certainly be the ones who are prioritized. But as it starts to roll out, and to 55 and older, and eventually general population, even teachers, employees, regular employees, you're going to want to know who in your workforce is vaccinated, what that means, what kind of vaccine they have, how long has it been, and what that really means for quarantine status. So that's really kind of the gist of what a contact tracing program does. And I'm going to go ahead and stop my share real quick. Let's see here. I think I stopped sharing, right? Did I stop sharing? I'm on, right? So that's kind of the gist of what contact tracing for the workplace is, and how it's different from a Department of Health or kind of municipality version of a contact tracing program. We found very effective strategies to mitigate exposure within school settings, very, very large school settings, to the point where we've had the past 6 to 8 months, no documented school or in business exposures, been able to mitigate those exposures within the classroom and in the school setting very effectively to keep the schools open, because we definitely need to get the kids back to school, and certainly workplaces can't afford to be shut down for much longer. So I'll stop here and give it back to Aaron. I think that's enough for my time for right now, right?
Thank you very much, Dr. Mendoza.